Hello everyone, welcome back to our channel. Today we are tackling one of the most crucial parts of your OET exam. Do you know what is that? Writing task. By the end of this video, you will know exactly how to use your 5-minute reading time like a pro and try to apply the 6 assessment criteria effortlessly, and you can make your letter clear, concise and effective, how to analyze a sample answer the right way, and how to improve your writing skills just beyond practice. Okay, let's get started. When it comes to OET writing task, it has three possible types of letters. You all know that, right? One is a referral letter, which means you're sending a patient to another healthcare professional for further care. And the second one is transfer letter. Your patient is being moved to another facility or healthcare provider. Third one is discharge letter. So you're updating the next caregiver about what has been done and what's next. Your reader could be anyone here, right? Could be a doctor, or they could be like specialist or an allied health professionals like physiotherapist or a dietitian. This means your approach must be flexible and adapted to each situation. Now, think of this way. Imagine you are explaining a patient's case to two different people: a senior cardiologist who has decades of experience dealing with heart related cases, and a community nurse who needs to monitor a patient's home care plan. Would you use the same details, same tone, and focus for both? Absolutely not. That's exactly how you should think when crafting your OET letter. When your first Now let's see how to use your 5-minute reading time efficiently. When you first turn over the test booklet, don't start reading every single case note immediately. Instead, your eyes should go straight to the most critical pieces of information. First one is, who are you writing to? Because that tells you what kind of information is important. And second one, what is their role? It helps determine what they need to know. And the third one is, what is your role in the patient's care? Because this going to shape your perspective. Okay, let's see an example here. Imagine you're writing a letter to Dr. Susan Carter, a pulmonologist, regarding Mr. Daniel Thompson, a 55-year-old construction worker who has been struggling with worsening chronic obstructive pulmonary disease, COPD. So now in this case, what should you focus on? His history of heavy smoking and exposure to construction dust, and the medications which has been prescribed and their effectiveness, his lung function test results, and is there any red flags like recent hospital admissions or oxygen dependence, and specific requests like whether you need Dr. Carter to assess his suitability for long-term oxygen therapy or further pulmonary rehabilitation. So all these things you need to focus when you are referring to Dr. Susan. But if you are referring to a nurse, a community nurse, so that means you are writing an email to a community nurse who will be visiting Mr. Thompson at home. Would you give the same details? No. For the nurse, you would focus more on his daily symptoms and their impact on activities of daily living and adherence to medications and inhaler techniques, support system at home, and is there any need for assistance, if there is any signs of worsening symptoms requiring immediate medical attention. So you will be focusing on these details, right? Now, see the difference. Your reader dictates what details matter the most. Now, you need to decide what to include and what to omit. So, when reading through the case notes, ask yourself these two golden questions. Is this relevant to the current situation? Will this affect how the reader continues care for the patient? If you're getting answers no for both the questions, then leave it out. But if either answer is yes, then include it in a structured way. So here is an example for relevant inclusion like recent hospitalization for severe COPD, exacerbation, poor adherence to inhalers, history of smoking and occupational exposure, right? So, recent hospitalization for severe COPD exacerbation because it shows disease progression, right? And poor adherence to inhalers because the pulmonologist needs to know this to adjust the treatment plan. And history of smoking and occupational exposure, these are the key contributors to his conditions. So you need to include all these relevant key details. But which is not relevant? Mild asthma as a child, minor wrist fracture 5 years ago. These facts are not at all relevant, not directly impacting his current situation, right? Or not relevant to COPD care. Got it? Now let's see structuring your letter. Once you have identified the key information, structure your letter in logical and in a very concise way. So start with an introduction, explain the referral or transfer or discharge and why it's necessary. Then include only the most relevant details in the patient's background. Medical history, yes, you need to summarize the necessary past information, okay, and describe symptoms, treatments, and progress for the current situation, and describe the symptoms, treatments clearly. And finally, you can request or you can give suggestions or what should be the action plan, like what you want the reader to do. Got it? Now let's go back to Mr. Thompson case and we'll craft a strong introduction. Okay? So here is a weak introduction also. So let's see. I'm writing to refer Mr. Daniel Thompson, a 55-year-old male with COPD, for further care. This introduction is very vague because it doesn't explain why the referral is happening. The purpose is not clear. So you can try to introduce in this way. I'm referring Mr. Daniel Thompson, a 55-year-old construction worker with a 30-year smoking history who has been experiencing worsening COPD symptoms despite optimal medication use. Given his recent hospital admission for severe exacerbation and ongoing breathlessness affecting his daily activities, I request your assessment regarding the need for long term oxygen therapy. Why I'm telling this as a strong introduction? Because it is clear, detailed, and provides a strong reason for the referral. Got it? Now let's do analyzing a sample answer the right way. When reviewing a sample letter, don't just copy it word for word. Instead, ask yourself, why did the writer use this phrase? How does this structure improve clarity? Did they include something I missed? If so, why? So imagine comparing your version of Mr. Thompson letter with the sample. If the sample included his vaccination status, but you didn't think, would this be helpful for the pulmonologist? If yes, then make sure to include such details next time. So, beyond practice, there are some strategies that you need to keep in mind. Assess your work against official OET criteria. Are you demonstrating clarity, conciseness, and relevance? You need to just assess yourself and try to use grammar tools like Grammarly in order to spot common mistakes and make a checklist of errors to avoid. And rewrite your letters with improvements because this helps train your brain to remember correct versions, not mistakes, and turn case notes into speaking exercises. You can do a role play with your friend and you can just, explain the case in your own words. Expand your medical knowledge. This is pretty much important because you need to read about workplace injuries, chronic illnesses, and treatment updates in order to enhance your vocabulary and understanding. Got it? That's all for today's video. For more expert tips, strategies, and sample letters, subscribe to our channel. Kindly like and share. See you in the next video. Bye for now.